Welcome to this edition of the Designs for Health audio science article.
Fiber is one of the most underconsumed nutrients, putting individuals at increased health risks, according to dietary guidelines published by the USDA in 2015. The report also cites a low intake of vegetables, fruits, and whole grains as the primary cause of this nutritional deficiency. Although whole grains aren't the most effective way to increase fiber, consuming adequate amounts of fresh vegetables and fruits certainly will achieve a better fiber score. Rather than turning to a better diet, many adults choose fiber supplements to make up the difference, but for many, this can be a poor long-term solution. When found in its natural dietary form, fiber is coupled with a plethora of vitamins and minerals that will synergistically enhance its health benefits. Each stage of life relies on adequate amounts of fiber, vitamins, and minerals to maintain optimal health, but pregnancy is a unique stage of a woman's life in which adequate dietary fiber is imperative. Not only will optimum dietary fiber curtail many pregnancy-associated complications, but it will also lower her child's risk of health problems. Gut microbiota dysbiosis is a root cause of many health problems, but especially digestive and metabolic diseases such as insulin resistance, type 2 diabetes, and obesity. Many adults exist with various degrees of dysbiosis, but the changes associated with pregnancy often exacerbate its risks, which can be transferred to the infant during birth and increase the child's risk for metabolic health problems later in life. Pregnancy naturally induces a state of inflammation in the gut, allowing pre-existing pathogenic bacteria to grow. Adequate dietary fiber has been shown to protect against the overgrowth of Celiac during pregnancy. Celiac has been directly associated with higher levels of circulating insulin, altered intestinal cholesterol absorption, decreased liver glycogenesis, and increased triglyceride synthesis. This bacteria also reduces the expression of tight junction proteins, increasing gut permeability and metabolic endotoxemia. In pregnant women, increased Celiac is most often associated with dysregulated blood sugar and altered insulin metabolism, which can lead to gestational diabetes. Gestational diabetes carries numerous health complications, including hypertension, preeclampsia, the need for a cesarean section birth, large birth weight causing labor and delivery complications, and increased risk for cardiovascular disease and type 2 diabetes. With increasing prevalence, there has been an effort to reduce the risks of developing this condition through dietary measures, and fiber intake is a critical player as it favorably modulates the gut microbiota. Celiac is commonly seen in overweight and obese pregnant women and may explain in part why this population also experiences higher risks of gestational diabetes. A study of 130 overweight and obese pregnant women whose dietary fiber intake was measured while their gut microbiota was analyzed showed that Celiac abundance correlated positively with circulating insulin, independent of maternal BMI, but negatively with dietary fiber intake. Therefore, adequate fiber intake altered the gut microbiota to improve insulin levels and decrease risks of metabolic complications such as gestational diabetes, protecting the health of the infant as well. More recently, a high dietary fiber intake during pregnancy has also been shown to reduce the risk of celiac disease in the child. Researchers found that for every 10 grams of fiber consumed daily during pregnancy, the child's risk of celiac disease was reduced by 8%. And if pregnant women consumed over 45 grams of fiber daily, their child's risk for celiac disease was cut by 1/3 compared to children whose mothers consumed less than 19 grams of fiber per day. These results were taken from a population-based study that assessed over 88,000 children born between 1999 and 2009. When these findings were announced by the lead researcher at the 52nd Annual Meeting of the European Society of Pediatric Gastroenterology, Hepatology, and Nutrition in 2019, he could not comment on the reason for the association. However, other studies have found a close association between the composition of gut microbiota, altered immunity, and celiac disease. Therefore, the association is likely linked to the ability of dietary fiber to positively modulate the microbiota of the gut. Sadly, most adults consume only half the recommended amount of daily fiber, which is 25 grams for women and 35 grams for men. If women are only consuming an average of 12.5 grams of fiber each day, They are falling far below the quantity required to foster good health both in themselves and should they become pregnant and their offspring. With metabolic conditions and gluten allergies and intolerances on the rise, it is important that practitioners communicate the necessity of a high-fiber diet, and especially during pregnancy. Although relying solely on fiber supplements and powders may not be a sustainable long-term solution, it may be beneficial to incorporate during pregnancy, in addition to increasing total vegetable and fruit intake.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.